Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today. In this episode, I will present the key points of a practically important review paper titled, When Direct Oral Anticoagulants Should Not Be Standard Treatment. This was published in January 2024 in the Journal of American College of Cardiology as a JACC state-of-the-art review article published by a group of authors affiliated with Brigham and Women's Hospital, Harvard Medical School. The advent of direct oral anticoagulants, DOACs, marked a significant advancement in anticoagulation therapy, eliminating the need for routine INR monitoring associated with warfarin. However, a comprehensive review highlights specific scenarios where direct anticoagulants may not prove beneficial and could even pose risks. This paper emphasizes that while novel anticoagulants offer advantages in various conditions, they shouldn't be universally applied without considering the evidence for each indication. Objectives of the review aims to identify situations where direct oral anticoagulants are ineffective or potentially harmful, providing guidance based on available evidence. Additionally, it addresses areas lacking sufficient research, urging further investigation. These are the do's and don'ts for direct oral anticoagulants. The following are the supported uses showing benefits. Direct oral anticoagulants are endorsed for stroke prevention in atrial fibrillation, AF, patients, including those with recent acute coronary syndrome, ACS, or percutaneous coronary intervention, PCI. Recommended for AF with many types of concomitant native valve disease. Indicated for acute and extended duration management in venous thromboembolism patients. Supported by COMPASS trial for low-intensity rivaroxaban in stable atherosclerotic cardiovascular disease. Benefits observed in patients with recent peripheral-artery revascularization, based on the Voyager PAD trial. The following are the contraindicated uses showing harm and direct oral anticoagulants should not be used. 1. Mechanical heart valves. 2. Rheumatic atrial fibrillation. 3. Transcatheter aortic valve implantation, TAVI. 4. Embolic stroke of undetermined cause, ESUS. 5. Left ventricular assist devices. 6. Heart failure with reduced LV systolic function without atrial fibrillation. 7. Thrombotic antiphospholipid syndrome, APS. These are the conditions with uncertain evidence of benefits with the use of direct oral anticoagulants. There are conditions needing further research and caution should be advised against the use of direct anticoagulants. End-stage renal disease, ESRD, breastfeeding and pregnancy. Left ventricular thrombus. Catheter-associated deep vein thrombosis. Cerebral venous sinus thrombosis. Splanchnic vein thrombosis. Adult congenital heart disease, chronic thromboembolic pulmonary hypertension. In summary, this review paper highlights that direct oral anticoagulants, DOACs, are generally preferred over vitamin K antagonists for stroke prevention in atrial fibrillation and venous thromboembolism treatment. However, randomized controlled trials suggest that DOACs may not be as effective or safe in certain conditions, such as mechanical heart valves, thrombotic antiphospholipid syndrome, and atrial fibrillation associated with rheumatic heart disease. DOACs are not recommended for conditions like the embolic stroke of an undetermined source. The paper emphasizes the need for an evidence-based review of DOACs, specifying situations where they demonstrate efficacy and safety, where they should not be the standard of care, areas of uncertainty, and the need for further research.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.